all set.
All right, I'm going to go ahead and call us to order here and get started. We do not have a quorum, so there's a number of things we can't vote on. So I'm going to focus on the items on the agenda that don't require voting. We don't have anyone for public privilege of the floor. I'll hold off on the approval of the minutes. And so if Brenda wants to provide the financial summary, we'll get started right with that. Can she hear me? Okay.
Yeah.
Oh, here's.
Yes, I can. The July financial statement was included in your packet. I don't have anything really to add regarding that to the written report. I will add on the 2022 budget submission, we did revise our over target request and included one for COVID response.
Great. Thanks, Brenda. That's the one we were talking about last time, right? That we had asked about?
Yes.
Okay. Okay, great. Any questions for Brenda? Okay. Frank, let's go ahead to you.
Sure. So I missed the last board meeting. Was away on vacation. I want to thank the staff for stepping in and allowing me to do that. It was great to be away and have a little bit of a break. You guys broke things while I was gone though, so I spent a week and a half trying to fix them all. But no, so obviously things have changed in the last month. Our disease numbers have gone up pretty significantly. We had a fairly decent spike in hospitalizations, nothing that ever really overwhelmed the hospital, but numbers we hadn't seen in several months. We're down to 3 people in the hospital now, I think on our last report, so that's good news. It's those in the hospitals are mostly unvaccinated. There have been a few that were fully vaccinated. So it's not wholly unvaccinated individuals, but primarily we're seeing both here locally and across the country that those in the hospital tend to be unvaccinated individuals. So the vaccine is working to address the severity of illness people are feeling, which is a really good sign. Particularly because we do now know that Delta is the strain that we're dealing with. I think the last time Cornell reported it was the high 90% of cases that they were able to review were all Delta variants. So that is what we're dealing with here. Staff has been working diligently to do the disease surveillance part of our work. We did have to pull in help from other divisions and other county departments. We have made some progress on hiring some help, bringing back some part-time nursing help. We got some additional support from the state with the temporary nurses. We're also hiring project assistants to help support with the contact tracing and making the phone calls. So it's starting to come together. Claire and Brenda have been doing an amazing job of bringing those folks on board to help out. On the vaccine front, several things have happened. Obviously, the first thing we heard was that immunocompromised individuals are those that were taking immunosuppressing drugs, are getting what they're calling an additional 3rd dose, not necessarily a booster. What they found is that in those individuals, the first 2 doses were not sufficient to create the immune reaction that we would want to see in somebody that's fully vaccinated. So they were authorized to get a 3rd dose. We will be accepting those people at future clinics. Our next clinic is September 1st and 2nd at TC3, but it is open to the public. But all clinics after that, including those, we will be offering it to those that need that additional 3rd dose as well. CDMS has been updated to include an attestation. So there's no doctor's note. We're actually prohibited from requiring a prescription. So it really is an attestation from the individual that they're eligible. So that will continue. The other big news was the talk about boosters for everyone. For Pfizer and Moderna, of course, we're just talking about now, not including Johnson & Johnson. They are still studying it. There is still, I don't think there's consensus yet on the data about whether or not the booster dose is the appropriate next step. We do think ultimately it is going to be approved. The federal government has set out a September 20th kind of starting point for when that would occur. And so if that does happen, the way that it is looking like it will be designed is that 8-month post your second dose, you would be eligible for the third booster dose. So it won't be everybody all at once. It will allow us to kind of do it over a rolling time frame, similar to what we did at the beginning of the year. Vaccine supply is not a problem, so that shouldn't be an issue. And we are working with the hospital to see, with Cuyahoga Health Systems, to see about reactivating the mall site. It likely will be a scaled down approach, just because we don't expect the demand will be the same that it was. We will have a general idea of how many people were vaccinated during that time frame. We would expect there will be some attrition of folks just not getting the booster. It will be available in pharmacies and at your local doctor's office. So there will be other places for people that might be more convenient. So we really are looking to plan what we think we can reasonably staff to be able to have that location on a recurring basis to vaccinate folks. So more to come on that as we go. I think everybody's aware we have a new governor today. And so that has obviously shifted things in Albany over the last couple of weeks. We're hoping that there will be a reinvigoration of the New York State Department of Health, some new leadership in place to help provide some of the guidance that's been missing over the last few weeks. But in the interim, we've been trying to support our community partners wherever possible by providing any additional guidance or recommendations. This past week, we put out a handful of press releases. One was about when to get tested and the use of over-the-counter tests. One of the things we're finding is that people are not reporting results from over-the-counter tests, the positive results to us, and we need them to. And I think there wasn't really clarity about when it's most appropriate to use antigen testing versus PCR testing. So we tried to clear some of that up. We did put a press release out about the increase to high transmission levels, which most of New York is now. But because of that increase in transmission rate, while I was away, the recommendation was put in place to wear a mask whether indoors, whether you're vaccinated or not, and that continues. And as part of that press release, we also formally recommended to our schools that they follow the NICEAD guidance, which does say that everyone indoors in the school should be masked, vaccinated or not. So that we've shared that with the school districts and have had conversations with the superintendents about it. So lots going on. We are looking at figuring out guidance around quarantining. We are not quarantining vaccinated close contacts as long as they're asymptomatic. Nobody else is doing that either. And we did not feel like there was anything sufficient enough here different in Tompkins County to make that leap. But we are certainly monitoring it. The other challenge that has recently presented itself is when the state of emergency was lifted, the essential worker designation and all of that mechanism that had been built went away. And so now we're dealing with, if we have an unvaccinated individual that is asymptomatic, they would be in quarantine if they were a close contact. But if they have a particular job, are they able to go to work as they were previously? I'm going to be talking with staff over the next day or two to figure out what our guidance will be around that. I've talked to my colleagues. Everyone's struggling with the same thing. There is some hope that DOH might present something in the coming days to help support that. But in the absence of it, we'll have to have a local procedure to deal with that.
How will you communicate that out when you make your decision?
Yes, yeah, we will definitely let folks know that. Right now, it's only come up a couple of times since it's gone away, so it hasn't been a huge issue yet. But I certainly can see it becoming a bigger one, particularly if we have, continue to have these levels of cases.
Yeah, I think that's a good point, and I just hadn't thought about that. So I think when you have the policy ready, if we can, okay, thanks.
Are we assuming that there's gonna be a big spike now that Cornell and IC is coming back?
I think we've kind of already seen that, right? Because they're back.
Right.
Will we see some more now when they start interacting over the next couple of weeks? Maybe. Most of those folks are vaccinated, right? So that's the good news about those populations. Quite honestly, I think where we're going to see the bigger impact is when the K through 12 starts up in the beginning of September. So we're going to have to watch that very closely and see how it goes.
Are there any other testing options? I know that I've received some constituent concerns about weekend testing not being available. And the WellNow clinic only has a certain amount of spots.
Yeah, the hospital is looking at expanding back to weekend hours at the mall. I don't think they're ready to announce that yet because they're still working through staffing, but they are doing that. I don't know that it's going to be both days, but I think it'll be at least one weekend day
That would be good.
available to folks. But yeah, that has certainly been a challenge.
Thank you.
Any other questions for Frank? Okay, Sam?
My report came in a little late, so it is in the packet now. But I just wanted to commend the communications team for COVID, that they've just done a really great job. And I was also able to take some vacation and they just, kept everything moving and very thorough and clear and informing to the public. And then otherwise, we did receive some instructions from the state about updating our community health improvement plan. So we'll start working on that, which will be due at the end of the year. And lastly, in July, at the end of July, the 4 public health ambassadors did end their work with us. One actually is continuing on to help with contact tracing with the increase in cases. But they, again, did a great job and put in, hours of work to promote the vaccine and clinics in the community. So that's all I want to add.
Great, thanks, Sam. Any questions for Sam? Dr. Claypack? You hear me? Dr. Claypack? Can you say his name closer to the microphone if you can't hear me?
Yeah, Dr. Claypack.
There we go. Now you can hear me probably. Hi, good afternoon. I would just add a little additional point about vaccines and vaccination. It's often a mistake that people make that they run the risk of lumping the number of vaccinated people we have as positive cases into the bucket of vaccine effectiveness. And if you look at the number of vaccinated cases, vaccinated people have become positive versus the unvaccinated people have become positive in relationship to the number of people in our county who are vaccinated and the number who are unvaccinated, the vaccine is at least twice as effective in preventing people from becoming a positive case. So it is doing what it's supposed to do. It's cutting down on the number of people who are becoming positive. And as Frank has pointed out, it certainly has kept them from getting severe disease. So it is working to keep people alive, and it is minimizing their symptomatology. There has been rolled out at the medical center monoclonal antibody treatment. The treatment is for 2 different target groups of people. One target group is unvaccinated individuals who have a close contact or a significant contact with a positive case. Those people may be fit the criteria for getting monoclonal antibody treatment, and we are putting into shape a process to be able to share that information with people that in our case investigation and contact tracing, we can't become aware of who would fit into potentially the category of benefiting from this treatment. The treatment can't be ordered by us as the health department. It must be ordered by a practitioner. And so we would be urging these people to contact their practitioner in order to discuss whether it's suitable for them. And then the second form of antibiotic treatment is for the target group of people who are symptomatic, but not severely ill. They're mildly ill. If they're mildly ill and they're positive, they may benefit from antibody treatment. And again, when we come across these people, we will be striving to make them aware, to contact their practitioner and consider whether that would be suitable for them. So those are a couple of shifts that have occurred. And I'd be glad to take any questions that people might have.
Any questions? Okay. Thank you.
Welcome.
So it looks like Celeste isn't here. Is there someone doing her report, or it's just included as part of the COVID stuff?
Claire's off today
Claire's on.
and she did not say, no, I think her report stands.
So Deb,
Hi, everyone. I'd just like to, I'd like to announce another retirement for my division. Another manager, Cindy Lalonde, has put quite a few years into public health.
there's Claire.
I'm sorry.
So go ahead, Deb, sorry.
Okay. And she retired on Friday, and I'd like to announce her predecessor, or her replacement, I'm sorry, is Michelle Card, one of our community health nurses. And then the other thing I wanted to make note of was, with the spike in cases, we did jump back in to help with COVID work during the week. And I just want to thank Claire and Brenda, HR, for quickly putting more help in place, bringing in the per diem staff to help us so that we can get back to our program work too. And that's it for my report.
Great, thanks Deb, and thanks to your team for jumping back in again. Claire, I wanted to come back to you. Did you have anything that you wanted to add to your report?
Hi, everyone. Sorry I'm late. I think you've probably addressed just the Delta variant and the effect on the surveillance needs in Tompkins County. So we're really focused on scaling up and providing as much guidance as we can to, particularly to, those who are in higher risk areas like nursing homes and unvaccinated individuals. But we're hopeful that we can apply lessons from the past, and that we will get through this together, and appreciate the kind of continued support from all the other divisions and perspectives from all the angles to problem solve and adapt. So yeah, I don't think I have anything specific to add, except appreciate the continued support.
Thanks, Claire. Jonathan is not here. Don't see him, right?
No.
Okay, and so Liz.
I don't have anything to add to my report.
Thanks, Liz. Harmony, did you want to talk about the CSB?
You're muted, Harmony.
Think I would know that by now. The Community Services Board does not meet in the month of August.
Okay.
I could give one little update, and that is that the Suicide Prevention Coalition we'll be hoping to plan a Chalk the Walk awareness event in this September. And that will be an event where people can write positive messages on their sidewalks around their building on a particular day or week to create greater awareness for that cause. So more to come on that.
Thank you. Okay, so we don't have quorum to vote. So do I need to find three? Or do we just roll this to next month?
Yeah, I was chatting with Liz. All of the enforcement issues are really, would just be delaying the fine.
Okay,
All of the other stuff has been addressed in them. Liz, is that correct?
Yes.
so
So
we'll
we
do,
can just delay them till next
Okay.
month, as with the minutes.
okay. And then is there any new business that people wanted to discuss while we're here? Shauna?
Yeah, I don't even know if we can add it to the agenda since we don't have,
I don't have a quorum.
yeah.
Yeah.
Okay, well,
Okay,
That was
next month?
maybe next month.
Okay.
Yep.
Sounds good. Okay, anything else?
Nope, I don't think so.
Okay, well, we've satisfied everything on the agenda, so that's it for this month. We'll see everybody in September.
And just FYI, we'll be at the health department at the next meeting, one way or another. We'll be doing it in the Rice Room again. Assuming we're allowed to meet in person.
Right. Cool. Thanks, everybody.
Thank you.
All right.
Any word on
Um,
the